Well, hello everyone, and welcome to Well Within Reach. And today we have our guest. We have nursing students from the Jefferson College of Nursing who have been working with us here at Frazier Family Coalition, doing their clinical rotation in community and population health. And we're going to start with Professor uh, Deborah Joseph. So,
Hello.
Professor Joseph, we want to have you introduce yourself, tell us a little bit about you, and then we're going to go around and have everyone introduce themselves and tell us a little bit about their first career, and then talk about why they chose nursing as their second career. So, Professor uh,
Yes.
Joseph, will go with you first.
Okay. My name is Deborah Joseph. I'm a psychiatric nurse practitioner. I've been a nurse for approximately 22 years. I've worked solely in mental health and substance abuse. That's been my specialty for all these years.
I cannot
Um,
hear too.
I'm sorry. And I love being at the Frazier Community Center. It is such a wonderful experience for not only the students but for myself. It's such a breath of fresh air to see Dr. White and Chef and Miss Cheryl and April collaborate together to educate the community in regards to health disparities and mental health diagnoses like diabetes and hypertension, which is so prevalent. And it just warms my heart to see everyone come together, and Chef makes these great meals and everyone talks and is educated during this time. Yes.
Well, thank you, Professor.
Okay, thank you.
Okay. Well, we could go around. Tatiana, you want to start?
Yes, I can start.
Mhm.
Um, so my name is Tatiana, and I have a background as a registered dietitian, and where I basically focus on nutrition, metabolism, and preventive health. Over time, I realized that I wanted to expand my clinical role and become more directly involved in patient care and medical decision making. So that's why I transition into nursing. And my ultimate goal is to continue into family nurse practitioner program where I can combine my nutrition expertise with clinical practice and work closely with patient on prevention, chronic disease management, and long-term health outcomes. So that's my dream job.
Thank you. Mint, want to tell us your story? Introduce
Yeah, my
yourself to
story
everyone.
is yeah, my story is a little bit long, but I can make it shorter. So, my name is Natchagun Patbinbayun. I'm from Thailand. My previous job, it's like my first job. I work like a supply chain, all the number, everything. So I have to calculate it, and then when I came here, I asked myself to like, do I still want to go back to the same job that I do, or do I want to try something else? So I decided to try something else because I feel like the previous job I don't have the work-life balance at all. I have to work like 8 to 12, but not like 12 at noon. It's 12 at midnight. So like 8 o'clock until midnight, and I feel like no, this is not good at all. And they didn't pay for the extra too. So I feel like I'm looking for something that make my life better. And during I came here, I work as an au pair, like a nanny. I feel like, oh, I like to take care of the people. I'm like to see them grow up. And I feel like nursing will be good for me because it's like you can see the patient getting approved. Like kind of you can see them change every day. So that's why I changed myself to be the nurse. Yes.
Okay, well, thank you. Hannah, you want to tell us a little bit about your story?
Hi, I'm Hannah. I am a nursing student. Prior to starting nursing school, I am currently a surgical first assist, working in organ and transplant surgery. I chose nursing for two main reasons. One being just the nursing career and the lateral and vertical mobility of it, and the emphasis on a career that you can learn more, do more, and see more. There's so many different areas you can go into. There's further education you can do, and I love that. But at the root of nursing that I'm drawn and most passionate about is patient care, and I wouldn't even say patient care, it's person care. And being in a career where it emphasizes patient advocacy, patient safety, care, and comfort. And as nurses, you interact with patients and people the most, more so sometimes more than their providers. And I think it's really important to not only treat them with medicine, but holistic medicine, and that's care, compassion, respect, and building that trust back into the health field. And I'm really passionate about that.
Thank you. And Cameron.
Hi, I'm Cameron. I have a background in health science, and I worked as a clinical research assistant and a medical scribe at a cardiology office. I always knew I wanted to go into some type of medicine. I just didn't exactly know what. But I was really inspired to become a nurse during COVID when I was actually in the hospital myself. And the nurses were like the most empathetic people I've ever met. They went to the drugstore and bought me a brush because the hospital combs weren't cutting it for me. Or since they knew I was interested in medicine, they would really teach me about it when they were working with me. And I actually had to get like a thoracentesis at that time. And I remember the one nurse specifically was super nice to me. She like held my hand, and since it was like through my back, she like talked me through everything that was happening. And it just really brought me the comfort that I needed to get through what was happening at the time. So I really just wanted to take their empathy and share it myself to other patients.
Well, thank you all for telling us your stories and why you chose your new profession, which is going to be nursing. And thank you for all of the work that you've been doing at the Frazier Family Coalition to help the community. I'm going to let Professor Joseph have the last say and give us some words of wisdom for maybe others who are considering nursing or thinking about it as a second profession. Anything you'd like to say to conclude?
I just want to say nursing is such a rewarding career. This is where I've definitely found my purpose and passion, just helping others. It is not easy. Nursing school is not easy. I'm sure I have witnesses right here in front of me that can attest, and including you, Dr. White. But it's definitely a difficult path. However, you just have to hang in there and hold your head high and surround yourself with positive people that are going to encourage you. And I say that because I remember my first nursing job at Presby. I was on an acute care of the elderly unit, and I literally cried every day. And I had the best manager in the world. I could call her cell phone and I would tell her, I can't do this. I want to give up. And she would tell me, Debbie, you are such a beautiful nurse. You just got to keep on. And, she is the reason why I'm here right now, because, but it's just a great career. And I would just say, embrace it and just realize that it's going to be a difficult road. But if you surround yourself with good people, you will be so successful. I mean, look at me. I've been a nurse 22 years and I wouldn't trade it for the world. I've touched so many people, right, Dr. White? I'm sure that you can attest for
Excellent.
all the lives that you've touched.
Oh, yes.
Absolutely.
Oh, yes, very much.
Yes.
So. Well, I thank you all and let you know how much we really appreciate you being with us today. So thank you.